Congratulations, and thank you for choosing the DermaPen fractional microneedling device, the most effective collagen induction treatment available on the market today. The DermaPen starter kit shown here includes an instructional DVD, a user manual, a box of 30 microneedle disposable tips, the DermaPen handpiece cradle, the DermaPen handpiece, and our complimentary bottles of HA Boost, a hyaluronic B5 hydrating and moisturizing serum, and Phyto Boost, a phytobotanical serum to soothe, calm, and provide anti-inflammatory benefits after the treatment. DermaPen treatment. The indications for use during this treatment are skin rejuvenation, skin tightening, reducing fine lines and wrinkles, improving texture, and improved skin tone and color. Before starting the DermaPen treatment, be sure to read the DermaPen treatment manual and consult your patient for a complete skin evaluation. During the consultation, please refer to the list of contraindications on page 24 provided in the treatment manual, and be sure to share the details of the treatment so the patient has clear expectations for the service. Also, because skin cells need nutrients for best function, be sure to share the patient home preparation checklist for a recommended anti-aging regimen on page 25. The first step to preparing the patient for treatment is a thorough cleansing of the skin with a cleansing product appropriate for the type of skin that is being treated. Be sure to remove all makeup and debris from the skin. The added pampering of a hot towel shown here will also increase the perceived value and enjoyment by your patient. It also has the potential to open the pores of the skin to allow better penetration of the anesthetic cream in the next step. Cleanse the skin thoroughly, and for optimal results, it is advisable to remove the decayed top layer of the skin and stratum corneum with an exfoliating treatment such as a microdermabrasion or a cleansing scrub. Once the skin has been thoroughly cleansed and/or treated with an exfoliating treatment, apply a topical anesthetic to the entire face and treatment area being treated. A topical anesthetic with varying percentages of active benzocaine, lidocaine, and/or prilocaine is recommended for the comfort of your patient. Be sure to read the indications for use on your anesthetic ointment prior to application to ensure proper use. Allow the anesthetic to set or occlude with a plastic wrap for a minimum of 25 to 30 minutes. For quicker results, occlude with plastic wrap for the duration of the waiting time. Next, remove the anesthetic cream with gauze or pads as shown here. The last step of the preparation phase before the treatment begins will be an antibacterial antiseptic application using alcohol wipes to sterilize the treatment area completely. This will remove any unwanted bacteria still present. Refer to the training manual for protocol and indication guidelines for depth guidance when treating each section of the face. Divide the face into imaginary separate sections and treat each section completely before moving on to the next section. Start with the forehead and then move to the cheeks, then the nose, upper lip, and finally chin. If you wish, you can also treat the patient's neck and décolleté. Uniformly apply the DermaPen HA Boost to the first section to be treated. The numerous micro-injuries created by the DermaPen needle tip will create microchannels promoting immediate hydration and lubrication to trap water within the dermis layer, resulting in better skin hydration while simultaneously providing the needed benefits of tissue repair. It is extremely important not to make contact with patient skin with the HA Boost applicator to ensure sterility and avoid contamination to the bottle and your patient. Begin the treatment by choosing the appropriate needle depth for the treatment using the guidelines supported in the training manual. With the free hand that is not holding the device, gently hold the skin taut. With the hand holding the device, use a steady and slow treatment tempo. Use short stripe-like motions, much like a microdermabrasion treatment, lifting the needle tip between each stripe. Avoid using a snake-like pattern where you do not lift the handpiece. The stripe motion will maximize the device efficiency and allow the user to deliver an even treatment. 3 passes may be necessary. Remember that when treating each patient, the skin goals and conditions must be evaluated. If the skin presents superficial damage or needed corrections, then 2 passes may be sufficient. However, if deep scarring is being treated or deeper wrinkles need to be improved, then 3 passes can be prescribed. During the first pass on the forehead, exert constant pressure and treat using vertical passes. Start at either the left or right side of the forehead and initiate contact at the bottom of the section and treat upwards toward the hairline. Follow this protocol, treating the entire forehead. During the second pass, exert constant pressure and treat horizontally. Divide the forehead into two parts and treat the right side and left side separately. Treat each side starting in the midline and working laterally across the skin. If a third pass is performed, use diagonal passes starting again at the midline of the forehead and work laterally, moving outward. Treat both right and left sides separately. After treating the first section, such as the forehead or cheek, place the Dermapen handpiece device on a sterile surface and use a gauze pad to wipe the treated area to remove any visible debris or minor bleeding. After wiping the treated area with a gauze pad, you must re-glove. With new gloves and before touching the Dermapen device, move to the next section and apply the HA boost. You may proceed to treat the new section as outlined above and repeat the instructions as before, being certain that regloving takes place after treating and cleaning of every single section. Following this step keeps the protocols compliant with the OSHA bloodborne pathogen certification criteria. It is suggested that you have this certification before using the Dermapen device. As you can see, it is not necessary to apply hard pressure, and try to avoid treating very sensitive regions, such as the protuberant area of the eye and irritated skin, such as pustular or nodular rosacea. Please see page 24 of the training manual for all contraindications. Refer to page 20 in the Dermapen training manual. Here you can identify from the directional chart each area of the face and the coordinating depth for each area. For example, the cheek area being treated here can be done from a minimal 0.5 mm to 2.0 mm. When treating the chin as shown here in the video, the training manual depth chart suggests a depth of 0.5 mm to 1.0 mm. When working the areas around the lips, be sure to understand if your patient is prone to facial outbreaks, such as cold sores. Medication is recommended the day of the treatment and for 24 hours following the treatment. The stamp-like motion shown here is ideal for use on deeper wrinkles as an optional third pass. This stamping allows for the needle penetration to be concentrated in areas where maximum collagen and elastin growth is desired. When treating the nose, be sure to refer to the directional chart found within the Dermapen training manual. The direction used to treat the nose should be a direction that is applied moving away and out from the bridge of the nose. Moving in this direction keeps the flow of blood and lymph from collecting in the venous cavity and protects against possible bruising if the needling creates any small nicks by accident. It is possible to treat the periocular areas of the eye. However, use caution and be sure to pull the skin under the eye taut with your free hand. Do not use a needle depth over 0.25 mm in this area. A delicate free hand can keep the skin stretched taut so that the areas such as the crow's feet are treated with maximum effectiveness and evenness. One of the many advantages of the Dermapen versus rolling techniques allows the practitioner to treat small areas around the eyes without risking unnecessary epidermal damage. The circumference of the Dermapen's small tip is 1/2 inch in diameter. The Dermapen's method of virtual painless delivery creates the perfect treatment for the neck and chest. The neck and chest are areas that many patients will often complain about. The Dermapen will increase the appearance of these areas by creating the microchannels that improve the availability of cell nutrients and the triggering of the wound healing cascade, which brings platelets, fibroblasts, epithelial, endothelial, and immune cells together to facilitate skin tightening, color, and texture improvements. When treating the neck, refer to the directionality chart provided in the training manual. As in the prior areas of the face, start with vertical passes working from the bottom of the patient's neck toward the chin line. Next, work the same horizontal passes using a medial to lateral direction as your guide. Oftentimes, it is easier to split the larger sections like the neck and the chest into individual parts. This allows you to have more control and focus per section, making the treatment more even and uniform. For areas with more distinct wrinkling or possibly scarring or other issues, it may be helpful to spot treat these areas with a third pass. Notice how the free hand is used to keep the skin stretched taut so that the treatment is done evenly and allows the needle tip to be flush and even with the patient's skin. After the entire treatment is complete, apply Dermapen PhytoBoost Recovery Serum to the treated area. Advise your client to apply this cream every 4 to 6 hours for 48 to 72 hours following treatment. A short window of time exists to apply any actives or serums. The micro-injuries created have formed microchannels, allowing the percutaneous absorption or trans-delivery potential for these serums. One study suggests these channels close within about 10 to 15 minutes. After the treatment, take precautions against sun exposure. Do not apply sunscreen or makeup for 12 hours after the Dermapen treatment due to the skin's channels being open for a period of time, and due to the toxic nature of some sunscreens on the market. A zinc oxide paste is recommended before the patient leaves your office. See the complete section on home care on page 21 of the Dermapen training manual.